Medical School for International Health, or MSIH, is a new medical school that was opened in 1998. It's a different sort of school. It requires study of international health and medicine, or global health. In the fourth year, they actually do a 2-month clerkship in a developing country. We're the only medical school in the world that has a required track in global health. So there was this growing awareness that there had to be special training to deal with people from other cultures.
This unique program aims at graduating doctors with special knowledge and skills in cross-cultural global health and medicine. We took the connection with Columbia University. The relationship is very close with Columbia. There is a connection with the staff of Columbia regarding the curriculum.
We're actively collaborating between Ben-Gurion University and the Medical School of International Health and research projects, evaluation projects internationally. And this is actually a major mission of both universities, Columbia and Ben-Gurion.
The Beersheva as a place, as a geographical site, is full of people from different cultures, and students working here will naturally be faced with all these different sorts of people.
And we are getting the opportunity to see an unrecognized village that's just outside of Beersheva, just to explore and get a better idea for us as medical students about the health issues facing the Bedouin population that lives here. I'm basically a Canadian of Pakistani origin, and I'm Muslim. And when I was about to come here, I was a little bit fearful and apprehensive that who I am as a Muslim Canadian would make me alienated and unwelcome. And I'm really happy to say that after 3 years here, I've felt really nothing more than welcome by most people.
There's an increasing need for cross-cultural training at the medical schools, because these days the chances of a physician to encounter a patient from a different cultural background are higher and higher. The students are divided into small groups. Each one of the groups is exposed to 3 different cases. And in each group, one of the students is interviewing the patient.
And you feel better today than yesterday. You feel like your condition's improved.
The other one are watching it, and they are giving feedback to the performance of their colleague.
Hi.
And in few of the specialties, there was a need to expose the students to a whole range of different aspects of the disease of the patient. So we developed a unique model that we call it a rolling case. And the students are exposed to the acute stage of the patient. They are interviewing the patient, they are performing physical examination, and then they discuss with the tutor whatever happened with this patient. And then the simulated patients come back in, and he's portraying the same case 3 months later. So in 1.5 hours, they're exposed like to 1 year of the patient's disease cycle.
But I definitely appreciated, having been a nurse and an EMT in New York City, how important it is to view the patient in the context of their culture. And I didn't realize how much the program would affect the way I see the world. It's opened up my mind so much more than I could have ever anticipated.
The main issue from our perspective is that we give them the opportunity to get some hands-on experience. This is a very good training before the real thing.
We're getting bigger. The name of the school is now spreading, and the unique training in global health and medicine. That in the future, we will also become a center for doing different kinds of research on cross-cultural medicine, on global health, global issues in prevention.
The basics of medicine, I think you can learn anywhere in the world, and they would be 80% similar. I feel like the experience that I'm having here enriches my personal education and my life education. And that I will be leaving not only as an excellent physician, but as a better person. And I think that goes a far way because I'm learning not just the science of medicine, I'm learning the art and science of medicine.